So let's go back to John Fleetwood's article and what the WHO document admits in their own words. To establish the framework, the authors defined the program as nothing less than a restructuring of how governments govern. Quote, digital transformation is the intentional, systematic implementation of integrated digital applications that change how governments plan, execute, measure, and monitor programs. And again, the quote that we just read you before then, at the heart of this is vaccines. This is the only context for every policy recommendation that follows: a global vaccination compliance system digitally enforced. So number one, they say that birth registered digital identity and lifelong tracking is part of this. The document describes a system in which a newborn is automatically added to a national digital vaccine tracking registry the moment their birth is recorded. When birth notification triggers the setup of a personal digital immunization record, health workers know who to vaccinate before the child's first contact with services. They specify that this digital identity contains personal identifiers. So a newborn whose electronic immunization record is populated with personally identifiable information benefits because health workers can retrieve their records through unique identifiers or demographic details, generate lists of unvaccinated children, and remind parents to bring them for vaccination. Of course, that reminder will eventually come with consequences. We already have parents being chased across state lines by CPS because they refuse to inject their kids because of their religious convictions. Imagine once a digital ID is in place that can limit their access to their bank account when that little reminder to vaccinate is not complied with. And it goes on, this is automated cradle-to-grave traceability. The system also enables surveillance across all locations. With a national electronic immunization record, a child can be followed up anywhere within the country, and I will say globally, once the system's, the interoperable global element is in place, and referred electronically from one health facility to another. This is mobility tracking tied to medical compliance. And again, just that example that we gave of parents are literally being chased across state lines because of this as we speak. Imagine a system where AI, which is going to be ruthless because it's programmed by people who are, is demanding children are removed from their parents' care because they didn't vaccinate. And there's no argument for a religious exemption when it comes to AI that doesn't recognize that.